Hi babes, welcome back to my channel. It's been a while since I posted my last video. I really miss you guys. Oh, 好想你们. I want to let you know that I've been staying offline because I was going through fertility treatment. I was going through IVF. I kind of just want to focus on the treatment. That's why I didn't update anything. But I've recorded my entire IVF experience for you. And I've also decided to do this video in all English, precisely for two reasons. Number one, before I started the treatment, I watched like a million videos online of other women sharing their experiences, encouraging each other, going through this process. I found it tremendously helpful, and I kind of want my experience, my video, to help as many women as possible. So I thought by making this video in English with Chinese subtitles, this video could reach more women, potentially helping women speak Chinese and women who don't speak Chinese. Reason number two being, a lot of you guys have told me that you've got plans to go overseas to either freeze your embryos, to do IVF, or you have plans to freeze your eggs. And you guys want to learn a lot of IVF related English medical phrases. So you actually want me to make this video in English. Hopefully it could be more helpful to you. I'm going to start by briefly talking about what IVF is. If you already know this, you can skip right through this part. If not, then keep on listening. So IVF stands for in vitro fertilization. It's basically three parts of a fertility treatment that helps people to conceive, to have babies. As you know, we women were born with all the eggs you will ever have. Every month, your body recruits a group of follicles that potentially contain eggs in them. And eventually, naturally, one egg becomes mature and all the other follicles with eggs potentially in them die off. And then this one follicle will eventually ovulate, hopefully with a mature egg. And if you have sex with your partner during that time, you could potentially get pregnant and have a healthy baby. So that's a natural pregnancy process. So what IVF does is that when your body recruits that number of follicles every month to get ready for one egg to ovulate, you actually inject more hormones into your body to make not only one egg mature, but all the follicles you recruited that month, potentially all of them mature. And then through a small surgery, they get out all the eggs. They collect all the eggs from these follicles, and they will do it outside of your body, try to fertilize these eggs using your partner's sperms. So there are two ways to do it. Number one, they can put it in a dish to let them combine naturally. Number two is through a procedure called ICSI. That is when you take a sperm and artificially inject it into an egg to fertilize it. And this is what we chose to do because through medical exams we did before IVF, we actually found out my husband has a high sperm DNA fragmentation, which means that we would benefit tremendously through the second generation IVF, which means you do a sperm selection first, then you artificially inject one sperm into one egg. After your eggs are fertilized, which is not guaranteed because you don't know how many eggs are mature after the surgery and you don't know how many would be fertilized. But after fertilization of the eggs, they will put it in a incubator and the embryologist will watch the egg grow to 5-day blastocysts. Not every fertilized embryo will have what it takes to make it into 5-day blastocysts. 中文这个 process 叫养囊. I know in a lot of Chinese IVF clinics, sometimes you freeze day 3 embryo, sometimes you freeze day 5 blastocysts. But at the clinic I'm at in the UK, they encourage patients to grow all of your embryos into 5-day blastocysts. And then they encourage you to biopsy the suitable ones and send it off for chromosomal abnormality test. Through a test like that, you can make sure that the embryos you do have are chromosomally normal. Therefore, the success rate for having a live birth, a real baby through the procedure is much higher. So this is the entire process in a nutshell. So the first step is checking something called the antral follicle count, which is how many eggs your body naturally recruits to get ready to ovulate every month. Here's my experience. Good morning, guys. Today is my first pre-stimulation scan with the Zeta West clinic. Oh, I'm pretty nervous. I didn't fall asleep until 1 a.m. last night and I woke up super early, like before 5 a.m. today. I'm a little anxious because I had ovulation bleeding for some reason. It was like a mid-cycle bleeding. I had that once years ago. For some reason, it just this cycle I had it. So hopefully it's not affecting anything. We'll find out. So this scan is very important. We'll find out the antral follicle count and all the important information. So come with me. I'll take you guys through the entire process. Okay, here is the clinic. We are here. All right, let's go in. They open at 9, so my appointment is at 9:30. So when you come in, this is the reception ladies, and we are going to the waiting room. The waiting room is really nice, actually. We're gonna go into waiting room. This is Zeta and all the lovely ladies. She's an angel. Love her. Okay, here is the waiting room. Super classy. Very nice. So I'm gonna sit here and wait. Have you guys ever had mid-cycle bleeding for some reason? Like during ovulation time, you bleed a little bit for 2 to 3 days. Problem is that I'm not entirely sure what I had was ovulation bleeding. I'm like super worried it could just be an early period, but it's highly unlikely because my cycles tend to be really, really long, like 35 days or even more than that. So like it's almost impossible for me to bleed on cycle day 23rd. So let's find out what it is. Yeah, this is a angel follicle count.
Yeah.
All right, are we done?
Yeah.
All right, that was painless. Great.
15 and 12.
15 and 12,
so
27.
number to start with.
Okay.
So when your period arrives, you let us know, and that's when we'll start stimulation.
Awesome.
We wouldn't expect every single one of those follicles to respond to the stimulation, but we will hope to get as many as we possibly can.
Perfect. Thank you very much, ladies. I also want to add that every clinic does it a little differently. This is just my experience. It might be different than yours, and there's no right or wrong. It just everybody handles it differently. So your doctor will give you a protocol according to your situation. So after the initial baseline scan, after you count at your AFC, which stands for antral follicle count, you can start injecting yourself with some really expensive fertility drug. It could get very tricky in the beginning. Hey guys, so right now it's day 1 of stimulation. So today, Nate is gonna help me do it, and tomorrow I'll do it myself. So we decided that we're gonna both do it. So if I need to do it in the future by myself for some reason, I still know how to do it. I watched a bunch of tutorials online. To be honest, everybody does it a little differently. I think there are probably things that just don't matter that much. You can do it either way. But this literally is our first time. We did not rehearse. So what you're seeing is what you're getting. Wish me luck. And Nate is like reading the rules and following the rules to the T. Okay, so this is Gonal F. I think in Chinese it's called guanafen. I'm injecting 300 IU per day. Everybody has a different dosage according to your doctor, but I'm doing 300 per day. And this is a pre-filled pen, and this pen has about 900 units of medication in there.
Yeah, so we take this off, and then we screw this.
You just screwed it on, right? And like until you feel some resistance.
No, just not too tight, just light resistance.
Yeah.
And then you can take this out.
Okay.
This is the outer cap.
This is it, right? And you dial it to your
And then you
dosage.
remove the outer cap.
This is like brain surgery. I don't understand why we have to do this ourselves.
So
And then you check for the bubbles, right?
Yeah, so I can
I
see
see
a bubble.
bubbles. Okay, so we're good, right? Are we ready? You have to dial it to the right dosage
Yeah, I know.
before injection. Whoa, the needles are kind of like long. I want to show it to everybody. I thought the needles were like really short, but can you guys see? It's like super long. But you can see like this is a lot longer than I thought. So you want to see that little bubble. And you dial it to 300, right?
Yeah.
You can turn it back and forth. So if you overturn it, you can always turn it back. 300. Okay, all we do is injection. So it's what do you call that? Subcutaneous or whatever the word.
Subcutical or something.
Yeah, whatever. It just means like this area. I have lots of fat over here to protect me from that really long needle. But you're supposed to clean this area first. I guess I just spray and then wipe.
No, you choose an area that you want to inject.
Okay, do you want to do it here?
Okay, sure.
But it's wet. Like we have to. Yeah,
Right,
just like
yeah.
clean it. Yeah, that's fine. All right. I'm a little.
Where's the exact area?
Do you want me to pinch?
Okay, sure. You ready?
I'm nervous.
Ready?
Sorry.
Maybe you should sit down for this.
I know I'm a little nervous.
But then
I think
conceal
I should stand up. I think
Okay.
not looking at it makes
Okay.
me feel better.
Okay.
I'm nervous.
Oh, yeah. I thought you like pain.
No, not this kind
I'm
of
going to
pain.
enjoy this.
Okay, fine. I'm not gonna look at it. I have to learn how to do this myself. So,
Ready?
okay, 5 seconds. Okay, yeah, ready.
1, 2, 3, 4,
Go.
5. And action. 1, 2, 3, 4, 5, 6, 7, 8.
It's right, okay.
9.
All right.
Okay. So this thing has gone to
Gone to zero. Okay.
Yeah.
So that was
That was it.
not bad at all, actually. I looked at it while he's injecting me. It was like not painful at all. Like I barely felt it. That was it, right?
Then, yeah.
You have to take the needle off.
Wait. Put this back.
I'm sure lots of people fuck up.
I just hope I don't. Okay, I just want to say that this is not the only thing I'm doing. I'm also taking this prescription drug called, let me just get the drug to show you. Okay, I'm also taking this drug called dexamethasone, 地罗米芬, something like that in Chinese. Anyways, this drug is supposed to help you respond better to stimulation drugs and also prevent ovarian hyperstimulation syndrome, which is a highly dangerous condition that could develop, that actually happens in about 1% of the people going through the treatment. I'm actually a high risk marker because usually a very high AFC, 基础卵泡, antral follicle count, which I have 27, it's like super high, and then a low body mass index. These are markers for OHSS, but the good thing is that I'm a little bit older. If you're younger, around the age of 30, you're also at high risk. But anyways, so I'm also taking this 1 tablet a day in the morning, and I'm doing this at night. You have to do this injection at the same time every day. Yeah, so I guess today we're done. Yeah. Yay! I was really anxious, but now I'm actually feeling pretty good. This is easy. Tomorrow, I'll do this myself. So I'll invite you guys to come to do this. I don't know, I just feel really emotional just talking about it. I don't know if I should feel like happy or like sad. Like it's really hard to describe the feeling I'm feeling now. It's like I'm excited. I don't know. I don't even know what I'm talking about. It's a mixture of emotions. Because going through IVF treatment is a very emotional thing, but at the same time you feel so hopeful. But anyways, first day success. Thank you for joining me, guys. I will keep updating you tomorrow. So tomorrow I'll do this myself. So yeah, and sleep well if you're doing this too, if you're on this journey with me, and yeah, we'll support each other. I'll see you tomorrow then. Hi guys, so this is day 2 of my stimulation. I will do the injection myself today. I'm a little bit nervous, but I think I should be okay. We have 900 IU of medication in here. I used 300 yesterday, so I got 3 injections per pen. I think I may need to put the needle in before I start cleaning myself. Alrighty, so let's put the needle in. How do you take this off? Just pull it? Yeah. Okay. And then this is the needle. So we do this, and do we just screw it?
Yeah.
Some resistance, right? And then do I pull it off?
Yeah, put it off.
Take it off, and then tab it, right?
Apparently you don't need to check for air now that you already used it. I think that.
Do I dial it? Right now it's 0.
Yeah, a bit of
But I should dial it to 300,
yeah,
now it's 0.
300. Yeah.
So you see it's 0. Okay, now this is 300. The long needle is here. Okay,
Now
let's
you
do
can
this. You hold it for a sec. Yes, this is the spot yesterday I went in. They said you don't do it at the same spot, so I guess I'll do it over here today. Clean myself.
90-degree angle into your skin. Push everything in, and then at least 5 seconds. Okay, at minimum 5 seconds.
I'm really nervous. I have to do this myself. Alright. Deep breath. Okay. Okay. 90-degree angle, right?
Yeah. All the way. Push more, push more, push more. 1, 2, 3, 4, 5, 6, 7.
Should be okay now.
Yeah, pull it out. Pull out. Okay, then release. Yeah, that's it.
Okay, that was not bad. It's just, I think when you're injecting yourself, you need a lot more courage because you're just like, you're looking at it.
Mm-hmm.
Next time when I do this, I'm gonna film the needle going in. I'll let you guys see. But
Yeah.
honestly, it did not hurt, so it's not bad. So let's take this off. And do we screw it?
Unscrew it.
Unscrew it. Make sure you dispose these properly, guys, because they're medical degree waste.
Put the cap back on.
Just put the cap back on. Now it's down to 0. This is day 2. I'll talk a little bit about my, reaction so far. I don't really feel anything yet, but I read that people usually don't feel anything until like day 4, day 5 of the stimulation cycle. So let's see. But so far, I hardly have any reactions, but it's only been 1 day. Today's day 2. Anyways, I'll see you guys tomorrow. I guess tomorrow it's your turn. You get to stat me again.
With pleasure.
All right, then I'll see you guys tomorrow. Hi
Hi babes. Okay, this is day 3. I had to think about it. This is day 3 of my stimulation cycle, and Nate was supposed to inject me today, but I've decided to do it myself again because I'm pretty sure that I want to do one more round of egg freezing in the future sometime in the US. So I would have to really get this down. I really have to know how to do this. So I'm gonna do this myself again today. Should be a lot easier. I think I want to show you like the needle going in. I don't know if you want to see that. Maybe some of you don't want to see that. I don't know. But let's get it started. Okay, what I'm gonna do is I spray myself. This is it, right?
No, you have to dial it in first.
Oh, that's right. See? That's why I need an extra pair of eyes to make sure that I'm doing it right. I almost just injected jabbed myself for nothing. 300. Okay, so let's go. Okay, day 3 stimulation done. I'm just gonna briefly talk about how I feel so far. Usually after like 10 minutes of me injecting the stimulation medication, I would start feeling crampy a little bit, but it's nothing more than how you would feel on a normal period. I think though that's my ovaries cramping, but I'm not entirely sure. I do feel like my face feels puffy, so that's probably like I feel like I have a lot of water retention. Just your body retains a lot of water. I think this is probably normal. Yeah, this is it for day 3. That was easy and painful. I'm no longer scared of injecting myself. The first day I was really nervous, but yeah, it didn't hurt. See you guys tomorrow. Day 4, 2 tiny bruises, a big bruise. Okay, 0. All right, day 4, done. Nothing to say today because I'm feeling exactly the same. What's really nerve-wracking is that you understand not everybody will react to medications the same way. Some people are poor responders, some people are hyper responders. So it really depends. And your doctor would have to guide you through the process. But you do monitoring scans while you inject yourself with these hormones. So doctors and nurses can see how your follicles are reacting. These scans are really nerve-wracking. Here's my experience going through the first and second one. Okay guys, this is day 5 of my stimulation cycle. Today, before I inject myself, I actually wanted to tell you guys that tomorrow is my first monitoring scan, which means that tomorrow is the first time they're going to take a look at me and realistically figure out how many of my eggs, how many of my 27 antral follicles are responding to the medication. So tomorrow's scan is very important. I'll take you guys there, but I'm a little nervous because honestly, so far, other than the fact that they know I have many follicles, 27, they have no idea how my body is responding to the medication. So tomorrow we will actually know whether the eggs are growing, how many of them are growing, whether the follicles are getting bigger, and we'll get a more realistic picture of how the cycle is going to turn out. I told you guys before, at my age, they said one cycle, if you can get 15 eggs out, if you can get like 8 eggs growing to 5-day blastocysts, you can get 2 normal, chromosomally normal ones through the 3rd generation chromosomal abnormality test. If you can get 2 chromosomally normal embryos in a freezer, that's a huge win. So tomorrow's scan is ultra important. Obviously, the scans after that are important too, but I just want to say that tomorrow is going to be a very important and big day for me. I'm a little nervous. So it's hard for me to even say, are the medications working? I'm sure it's working. I'm a little bloated. My face feels a little puffy, like I feel a lot of water retention. The water retention I'm feeling, it's like how you feel right before a normal cycle. Maybe that's normal, maybe it's not normal. I have no idea. Another thing to say is tomorrow is day 6. I will start another injection in the morning as well. The stimulation injection, I do it at nighttime, 6 p.m. every day. The morning one will be a little different. So the morning one, it's actually to prevent my eggs from premature ovulation. So it stops ovulation before the egg collection day. So starting tomorrow, I'll get 1 injection in the morning, 1 injection at night, and of course still taking that pill that I've been taking in the morning. Anyways, okay, let's do today's injection. All right, so I already cleaned my hands. This is the spray to pick an area. I'll do over here too again. Don't know if you guys want to watch this. It's so boring, but I'm still filming it anyways. Another day, another jab. 3, 2, 1. Okay, goes to 0. Okay, so that was day 5. It's done. Starting tomorrow, I'll do 2 injections a day for the rest of my stimulation cycle. There's a lot of holes around my belly button. I guess that's normal. I was chatting with a lot of people in our VIP group from the WeChat store, and we have this WeChat group, and several girls in that group are actually going through fertility treatment with me. It feels really good just talking to people who have the same experience, so this is why I'm putting this out there for people who have struggled with fertility, who are going through fertility treatment, or who are struggling with this journey. You're not alone. I'm with you. Just want to tell you again, I know I've said this so many times before, just want to let you guys know that I'm here for you. And yeah, that's it. Tomorrow, it's an important day. I'll take you there. Wish me luck, guys. I need a lot of it. I really need luck. I don't want a cycle to go to waste. I've done so much so far. Anyways, see you guys tomorrow. Good morning, babes. It's day 6 of my stimulation cycle. I have my monitoring scan today, but before that, I'm going to start the morning injection today with this medicine called Firmidel. It's apparently preventing you from premature ovulation, so you want to save all the eggs for your egg collection day. And I watched some tutorials online, so we're going to inject myself with this morning. I just woke up. All right, it doesn't look that difficult. It's pre-mixed syringe. So you just, I guess, looks like the needle is a little bit longer. All right, let's see. It's called Subcutaneous Injection, meaning that around your belly button. I finally learned how to say that word, subcutaneous. Cleaning it a little bit. So far, I have not had a lot of bruising. The needle is...
Give it.
Yeah. Okay, now, right? All right. Okay, it didn't hurt, but the needle was a little bit harder to go in. So you had to like push it a little bit. You feel your skin like getting poked through. So that's an experience. But overall, not too bad. Oh, another thing I want to mention is that I read online a lot of people have side effects after this injection. Many people report that Firmidel gives you this rash. It gives you this red rash around your injection site, and it goes away after 1 to 2 hours. Apparently, that's a really common side effect. I'm not sure about mine yet, but it's feeling a little itchy, so it's definitely feeling different than the stimulation thing that I've been injecting myself with. I just want to let you guys know that I feel a little bit itchy. Hopefully I don't develop a rash. We'll see. Okay, remember when we talked about getting a rash after that shot? The Firmidel shot? There you go. I have a rash. And it's really itchy as well, but hopefully it goes away in about 1 to 2 hours. It's a very common side effect. Good morning, babes. Now I'm on my way to my first monitoring scan. Before that, I have to get my blood test done. So the nurses can look at your blood results to see the hormones in your body, mostly estrogen. I think they want to see how your body's reacting to the stimulation in combination of the scanning results to know how your follicles are developing. So every time I go in for a monitoring scan, I need to get my blood test first. So let's get jabbed again. I don't know if they'll let me film in there. If not, then I guess we'll just see you guys after.
6 millimeters. So nicely growing follicles, you can see there.
Okay guys, I just finished the first monitoring scan. So the doctor said so far they can see around 20 follicles developing, but they're not sure how many of them will be mature by the time that I collect my eggs. And so far it's a good response. They will review the blood test results and then give me advice on whether I need to change my protocols or not. But so far so good. And of course, it's all about the day before your egg collection, like how many mature follicles you're going to have and how many mature eggs you're going to have. So right now the number is just preliminary. According to Dr. Simone, someone of my age, if I can get out 15 mature eggs, that would just be a miraculous, like spectacular number. So let's see. Fingers crossed. First scan, we're doing good. So I'm coming back here in about 2 days. So I'll keep you guys updated too. Okay, as you know guys, this morning I just went to my first monitoring scan. The nurse said there were about 20 follicles growing, but you know, it really doesn't really mean anything until we get to the last day or even after the egg collection to see how many
eggs are actually mature. This is the day 6 night injection of GonorF, so let's get to it. I'm telling you guys, like a lot of you asked your husband to inject you. To be honest, the only bruise I got was when my husband injected me. And from the YouTube tutorials I've seen, they all said that if you inject yourself, it hurts less and less chance of bruising. So I guess maybe if you can't do it yourself, this is what I'm doing. It's getting easier and easier now. I'm getting more and more bloated. You can see I'm getting fat, like really bloated because I've got lots of water. Normally you ovulate 1 egg, and now they're trying to get 20 eggs. Just imagine how big your ovaries get, and with all the hormones too. Okay, day 6, second syringe finished. Oh, I'm starting to get really bloated, and this injection site this morning has got a bit of rash, but that rash has gone away. I'm glad to see that. Alrighty, I'll see you guys tomorrow at my day 7 injection then. Day 7 morning injection. Okay, not too bad. It's literally getting easier and easier. Okay, this is Stimulation Day 7 night injection. New syringe, new pen. Woohoo! Done. Hopefully only 4 more days to go. I just woke up in the morning. Stimulation Day 8 morning injection for Medell. Okay, so far so good. Hi babe, it's day 8, Stimulation Day 8. I'm actually in a public bathroom because we are out watching a football game and I needed to inject myself in the middle of it. So we're doing it in a public bathroom. Let's go. Okay. I'm so glad to get this done. It's so weird to be doing this in a public bathroom in the pub in London. Stimulation Day 9 morning shot for Medell. I'm getting really bloated now. This is day 9. Look, like I feel like really bloated. This is like, I don't know, like it feels really, really hard over here. So my ovaries are enlarged. Let's inject. Okay, I actually have my second monitoring scan today. Wish me luck. I need a lot of it. Good morning guys, today is the second monitoring scan of mine. Again, I have to go get my blood tested first before I go in. Today is also very important because we're gonna find out of the 20 follicles reacted to the stimulation so far, how many of them are growing or how they're growing. So we'll have a better picture of how this round of IVF is going to go. Wish me luck.
Well done. There we go. I'll let you get this, all right?
So we just did our second round of monitoring scan. A bit of surprise here. The nurse actually said we are ready for egg collection a little bit earlier than we thought. It's so annoying. Someone is doing construction. It looks like that we are going to trigger a little bit earlier than we thought and do the egg collection a little bit earlier too. We're still in the doctor's office waiting to speak to the nurse. I'm very excited because I'm actually triggering a little bit earlier and doing egg collection a little bit
I've seen
earlier.
your numbers and you have done very well.
Okay, thank you.
You've done really well. You've got a good number of follicles there at the moment.
Okay.
So it's good. So I'll go through everything with you.
The trigger shot usually refers to an HCG injection that gets your follicles ready for egg collection. It has to be done exactly 36 hours before egg collection. So you have to schedule your surgery first, and the clinic usually will let you know exactly at what time you have to inject yourself.
So I'm just calling for the trigger times and the egg collection. Your Gonasi 5000. So that means your egg collection will take place on Wednesday, 12 p.m. on midday.
12 a.m. tonight and then 12 p.m. on Wednesday. That's my egg collection. Got it. Thank you.
No problem. Thank you.
Hi babes. It's Stimulation Day 9 nighttime. Today we're not doing stimulation. Stimulation is over. The reason being, during my second monitoring scan today, I'm supposed to have another monitoring scan the day after tomorrow. My egg retrieval was scheduled towards the end of this week. This is Monday. We thought we were gonna, collect my eggs on Friday. However, the nurse told me that I'm ready. So I'm triggering tonight, and my egg collection got pushed forward from Friday to Wednesday. So this is a sort of a surprising development, but I guess it's a good development. That means that I'll have a couple more days to rest and recover before I fly back to Singapore. So I guess it's good, but in a way I'm also a little worried. I've only been triggering from day 1 to day 8 with a GoNO-F shot for 8 days. So I've had a total 8 days of stimulation. I don't know what that means, because normally people stimulate from anywhere between 10 days to 12 days. So this is a little bit on the shorter side. Today is day 9. No more GoNO-F today. I only got the Firmidol this morning to stop myself from ovulating, and then I take the oral pill one more time tomorrow morning. I'm done. This trigger shot is a little bit different. So this one is actually you mix the solution first and then you inject it. So it's a little different. I'll ask my husband to mix it for me, and I'll inject myself so he feels like he's participating. That's basically how this is gonna go. And then after that, I'm just waiting for egg collection. That's it. This is the trigger shot. So I will be administering this shot at exactly midnight. I am just a few seconds away from midnight. Okay, it's midnight. Done. I'm triggered. Officially triggered. Egg collection 36 hours later. Okay, obviously, as you can see, I'm back in Singapore, so my surgery is done and the results are out. I want to let you know that every single step, the results are highly unpredictable. Every woman reacts differently, so the nurses can't really tell you whether your cycle would be successful. I know that a lot of women would actually have to go through IVF many rounds to get a baby. Some people would actually have to get their cycles canceled if their follicles didn't react the way that their doctors predict. So getting here is actually a really important step. And after that, obviously we have a lot more to share. But since this video is so long already, I want to end here, and please come back to see my egg collection surgery, to see how I reacted to surgery, and to see the result of my IVF as well. Thank you so much, guys. I hope you find this helpful. If you have any questions, please leave your question at the comment section down below. I want to be here for you. I'll see you at the next episode. It's egg collection day. Finally, I am not nervous at all. I'll be changing into a hospital gown here. I'm all changed up. I hear Dr. Simone outside. I'm ready. Wish me luck.
I just woke up. I'm still groggy. I think I'm still out of it because of the anesthesia. Let me wake up a little bit and I will talk to you guys soon. I'm glad I get to film this. I'm feeling really unhappy about for some reason. I'm just feeling really upset. But, I can only focus on things I can control. Can't really deal with the rest.
Oh, come on, give me a hug. Oh.